people, namaste, welcome back to my channel. In this video, I will explain about the another important questions in gynecology. Small, short answer question is premenstrual syndrome, PMS. PMS means premenstrual syndrome. Yeah. So before discussing premenstrual syndrome, in previous video I discussed about the dysmenorrhea. Okay, dysmenorrhea pain during menstruation, cyclical abdominal pain menstruation. And this is the video of continuation. This is also important short answer question for university exams like premenstrual syndrome. So in premenstrual syndrome it is also called PMS. What are the clinical features? Like mood swings and bloating will be present in premenstrual syndrome. What are the present? Mood swings and bloating. Mood swings means most common physiological symptom. Physiologically, physiological symptom is mood swings, and most common physiological, it is also most common physical symptoms, physical which is physical symptom, most common physical symptom, most common physiological symptoms. So mood swings are the physiological, bloating is the physical symptoms. This is the clinical features present in premenstrual syndrome. Next, how you diagnose it is a premenstrual syndrome. See, symptoms should interference with routine activities. How these symptoms like premenstrual syndrome, like bloating and mood swings, because of these symptoms, should interference with the routine activity. These are the two symptoms: interference with routine activity. How you diagnose this? If the routine activity is interference, and be seen in an at least be seen at least three consecutive cycles, be seen at least in three consecutive cycles. Results after menstruation, these symptoms are decreased, like mood swings and bloating, and three consecutive cycles these symptoms are present, and this interference with the routine activity also be seen in post ovulatory phase. After ovulation, ovulatory, post ovulatory phase, it can be seen. Okay, it can be seen. Never seen in pre ovulatory, never seen in pre-ovulatory condition, pre-ovulatory phase, only in ovulatory, after ovulation, post-ovulatory, not pre-ovulatory, and decreases after menstruation, seen at least three consecutive cycle, interference with this routine activity. So presence of all these five, if all five are present, then it comes under PMS. This is the PMS diagnosis. How we diagnose all these five? Ask about the first clinical features, like mood swings or bloating is present. If these interference with the physical activity, these are present after the post ovulatory phase, and it decreases after menstruation, been at least three consecutive cycles, and never seen in like a pre-ovulatory phase. If these five are present, then it comes under the premenstrual syndrome. This is the diagnosis. Next, how we management premenstrual means mood swings and bloating. Mood swings means what? SSRI inhibitors. Like first one is fluoxetine can be given. Fluoxetine drug of choice. And if there is insomnia, we can give alprazolam. Insomnia. For best tenderness is also present in these cases. For that, we can give evening primrose oil. Evening primrose oil. Evening primrose oil, fluoxetine, alprazolam for insomnia, and for if there is bloating, diuretics can be given, like for water retention. For bloating, water retention is occurring in this case, so diuretics can be given, and pyridoxine, vitamin B6, all this can pyridoxine, diuretics for best and evening primrose oil and alprazolam and fluoxetine can be given in this. And along with this, ask them to lifestyle changes in second half cycle. Decreases sugar intake, decrease salt intake, decrease caffeine intake, decrease sugar, calf at the second half cycle, second cycle. second half cycle we can decrease sugar intake, salt intake, caffeine. So this is the if they ask in short answer question, you can write premenstrual syndrome. This is a short answer question. Okay, first what are the clinical features you can write, and how you diagnose you can write. Next, what is the management, fluoxetine and alprazolam for insomnia, breast tenderness, evening primrose oil, diuretics and pyridoxine. Lifestyle management, second half like decreases the sugar intake and decreases sugar intake, salt intake, salt intake and caffeine intake. All these can be seen. Okay, thank you. Please subscribe my channel and please support us. Thank you.